Ever get this like super intense stomach pain just out of nowhere?
Oh, yeah.
But what if it's like way worse than you think? That's what's scary about acute mesenteric ischemia,
AMI.
right? AMI. Today's deep dive is all about this tricky condition.
It's when blood flow to your intestines, it just tanks, like really drops. And that, well, it can be really bad news fast.
And we've got all this research here, right, showing just how hard AMI is to catch early.
Yeah, we're talking compromised blood supply to the bowel, why doctors miss it, and the latest on catching it before it's too late.
So inside our bodies, what's actually going wrong with AMI?
Basically, picture your intestines, right?
Yeah.
They need a constant supply of blood. But with AMI, something blocks that flow, or at least slows it way down.
So the arteries and veins, they're like the delivery routes?
Exactly. And something's messed up with those routes. Could be a clot, like a traffic jam,
Mhm.
or the arteries themselves are narrowed. Think of it like old pipes. Sometimes blood flow is even diverted away, especially if there are blood pressure problems.
So the intestines get starved of blood.
Exactly. And that's when things go downhill fast. Without enough blood, sections of the intestine can actually die.
That's terrifying. And you said it's often misdiagnosed.
Yeah, the early symptoms are really sneaky. They look like a lot of other less serious things, like bad indigestion, even food poisoning sometimes.
So not as dramatic as, say, a heart attack.
Right, with a heart attack, usually it's pretty clear something's really wrong. But the research shows AMI actually isn't that rare. We're talking 0.04 to 0.07% of adult hospital admissions.
Wow, that's more common than I expected. For something that's often missed, I mean.
Exactly. And that's why we're doing this deep dive. People need to get this, even without a medical degree, because understanding AMI could save their life.
Totally. Okay, so why does it get missed so often then? It's because the symptoms are so easy to confuse, right?
You got it. The symptoms, they're nasty, don't get me wrong, but they're not specific. Sudden, severe abdominal pain, nausea, vomiting, sometimes even blood in the stool.
Yeah, I can see how that would be tough to pin down to one thing.
Exactly. And to make things even trickier, AMI can show up in different ways.
What do you mean?
Well, there are actually different types of AMI. Each one is a little different. There's occlusive arterial AMI. That's when there's a blockage in the arteries themselves.
Like that traffic jam you were talking about earlier.
Exactly. Then there's occlusive venous AMI, where the blockage is in the veins carrying blood away from the intestines. And then there's NOMI, non-occlusive mesenteric ischemia. That one's the most common and often the absolute trickiest to
I
catch.
don't even know, my. What makes it so hard?
We'll get into that more later, but basically with NOMI, the blood flow is reduced, but there's not a complete blockage, so it's harder to see on scans.
Sneaky.
Tell me about it. Diagnosing NOMI is a real puzzle. Doctors have to rely on subtle clues, their own experience, and specialized tests.
I bet missing those clues can be bad news.
Absolutely. Studies show the longer it takes to diagnose AMI, the worse the outcome, often fatal. The average diagnosis time is a whole 24 hours, sometimes even longer.
24 hours? That's a long time when your body's not getting enough blood.
It is. And sadly, by the time some folks get to the hospital, the damage is already done. That delay is a big reason why AMI has such a high mortality rate.
Wow. So early detection is everything.
It's crucial. Catching it early and treating it quickly, that's the key to beating AMI.
So before the break, we were talking about early detection for AMI and how important that is.
It's everything, really. Every minute counts with this condition.
No kidding. So how do they even figure out it's AMI? I see this research papers mention CT scans a lot.
Oh, for sure. CT scan's usually the first thing they do if they think it might be AMI.
Makes sense, like getting a peek inside, right? But even CT scans aren't perfect, huh? I'm reading here that they can miss things.
Yeah, they're good, don't get me wrong. But there are limits.
Mm-hmm.
Sometimes a CT scan will show some inflammation, maybe fluid in the abdomen. But that could be a bunch of things, not just AMI.
So it's not always crystal clear what the scan is showing.
Right. You got to read between the lines sometimes. Even experienced radiologists, they can miss those subtle signs.
And then there's this whole lactate thing, right? Threw me for a loop. Reading that normal lactate doesn't mean you're in the clear.
Yeah, that's a common misconception. See, when cells don't get enough oxygen, they produce lactate. So naturally, you'd think high lactate equals AMI, right?
Makes sense to me.
Well, here's the thing. Early on in AMI, lactate can be totally normal. It's later, as things get worse, that you see the spike.
So even with tests, there's still that chance of missing it, especially in those first few hours.
Exactly. And that's where the doctor's gut feeling comes in. It's not just test results, it's also the patient's history, their symptoms, what the doctor sees during the exam. It all matters.
Like solving a mystery, putting all the pieces together.
You got it. And some of those pieces, especially with NOMI, they can be really hard to spot.
Right, no my. We touched on that before. What makes it so tricky again?
Well, like we said with NOMI, the blood flow is low, but there's no full-on blockage. So on a CT scan, it's harder to see.
Like the blood's moving slow, but not totally stopped.
Exactly. And to add to the confusion, NOMI usually isn't caused by the usual suspect, atherosclerosis, clogged arteries.
So not those hardened, narrowed arteries we hear so much about.
Could be, but often not. NOMI is often triggered by other things: low blood pressure, irregular heartbeats. Some medications can even do it if they constrict blood vessels.
So it's a real head scratcher for doctors sometimes.
You could say that. It really highlights the importance of experience and really paying attention to the details.
So if a doctor's thinking no MI, what are they looking for? Besides the symptoms, I mean.
Well, they'll be looking for those subtle signs on the CT scan. Things like pneumatosis intestinalis.
Whoa, hold up. Pneumatosis. What now?
Sorry,
Yeah.
it's a mouthful. Right. It basically means there's air trapped in the bowel wall. That's a big red flag for us because it tells us the blood flow is messed up. They'll also look for poor contrast enhancement, meaning that when they inject the dye, the bowel wall doesn't light up like it should. Another sign of bad blood flow.
So they're looking for these clues, but even then it's easy to miss, huh? Especially early on.
Unfortunately, yeah. It's all about those tiny details, and missing them can have huge consequences for the patient.
We've talked about how hard it is to diagnose AMI, but even when they do catch it, treatment has its own challenges, right?
Oh, absolutely. Treating AMI is not a one-size-fits-all thing. It really depends on the type of AMI and how far it's progressed.
So every case is different.
To some extent, yes. For occlusive AMI, where you have that blockage, the priority is to get that blood flowing again, ASAP.
Clear the traffic jam.
Right. That might mean surgery to remove the blockage or bypass it. Sometimes they can do less invasive procedures, like using a catheter to deliver clot-busting drugs or put in a stent to open up the narrowed vessel.
And what about NOMI? How do they treat that?
Well, because NOMI is not caused by a full blockage, the approach is a little different. Often they'll use medications called vasodilators.
Vasodilators, what are the...
So vasodilators, they're meds that relax and widen your blood vessels. It's like taking the pressure off the pipes, letting that blood flow freely to the intestines.
So it's less about removing something and more about improving the flow.
Exactly. But here's the catch. Vasodilators, they can make your blood pressure drop too low if you're not careful. Doctors have to watch patients on them really closely.
Sounds like a delicate balance to strike.
It is. And even with the right treatment right on time, there's still the risk of long-term problems, like short bowel syndrome. That's a big one.
Yeah, the research mentioned that. What is that exactly?
So short bowel syndrome, it can happen when they have to remove a big chunk of the small intestine because of the damage from AMI. Problem is, your small intestine, that's where your body absorbs most of its nutrients and water.
So if you lose too much of it.
It can't absorb what it needs. And that leads to a whole cascade of problems. Malnutrition, weight loss, constant diarrhea, vitamin deficiencies, you name it. It's life-altering, really, and needs ongoing management.
Wow, that's a lot to process. We've covered a lot different types of AMI, how hard it is to diagnose, the complicated treatments, and then these long-term issues on top of it all.
It's a lot to unpack, that's for sure. But I think it highlights just how important it is to know about AMI.
For sure, but it can't all be doom and gloom, right? What does the future hold for AMI? Is there any good news? So much to think about with AMI, it's a lot.
It is, yeah. But hey, like they say, knowledge is power, right?
That's what we're going for with these deep dives, for sure.
Absolutely. And
Yeah.
with AMI, early detection, that's key. Like we keep saying, the sooner the better.
Right, and that's why we got to talk about those signs and symptoms, make sure people know what to look for.
100%.
Yes.
And don't mess around, you know? If you've got bad abdominal pain, especially if it hits you out of the blue or it's way worse than usual, get to a doctor. Seriously.
Because, like we said, it's easy to brush it off, think it's just indigestion or something.
Exactly. And listen, I'd rather see someone for a false alarm than have them wait too long with AMI.
Yeah.
You know?
So, no such thing as being too cautious, even if it turns out to be nothing.
Absolutely. I'll say it again. I'd much rather see a patient with a simple stomachache than miss the chance to catch AMI early.
So, what about those people listening who are like, okay, but how do I know it's bad enough to go to the ER? What do you tell them?
Honestly, trust your gut, literally. If something feels off, if it just doesn't feel like your normal aches and pains, it doesn't go away, get it checked out.
Because with AMI, like we've been saying, every minute counts. Waiting can be. Well, we've talked about the risks.
Exactly. And here's something else to keep in mind.
Yeah.
If you've got any of those risk factors for AMI, you got to be extra careful.
Things like being older, having blood clots in the past, atrial fibrillation, right?
All of that. And of course, atherosclerosis. Anything that can clog up those blood vessels. If that sounds like you got to be on the lookout for any weird abdominal symptoms
Yeah.
and tell your doctor right away.
So be proactive. Know your own body, your own medical history.
Exactly. The more you know, the better decisions you can make. And you can work with your doctor, not just be told what to do.
Speaking of doctors, anything promising on the horizon for AMI? New treatments, better ways to diagnose it.
Actually, yes. There's a lot of cool research happening right now. For example, scientists are looking for new biomarkers for AMI. More sensitive, more accurate.
So these biomarkers, they'd help doctors diagnose AMI even earlier.
That's the idea. Imagine a simple blood test and bam, you know for sure if it's AMI, even in the very early stages. Game changer.
That would be amazing. And what about treatments? Any new breakthroughs there?
Oh yeah, definitely. They're working on less invasive ways to restore blood flow when there's a blockage. And for NOMI, more targeted vasodilators with fewer side effects. That's the dream.
So faster, better treatment with fewer downsides. Sounds good to me.
Right. And even better, they're trying to figure out how to predict who's at risk for AMI before it happens, identify those folks early, and intervene.
Wow, so we're talking prevention instead of just reacting after the fact.
Exactly. I think that's the future of medicine right there. Personalized, proactive, and focused on catching things early. AMI is a tough one, no doubt, but the more we learn, the better we get at fighting it.
Absolutely. This has been such an informative deep dive, really eye-opening. I feel like I learned a ton, and I'm sure our listeners did too.
I hope so. These conversations are so important, you know? Shining a light on these conditions, even the scary ones, it's how we beat them.
Couldn't agree more. Thanks again for being here and sharing your expertise. It's been a pleasure.
Thank you for having me. Always happy to talk about this stuff.
And to everyone listening, you heard the expert. If you're having any of those symptoms we discussed, don't wait. Reach out to your doctor or head straight to the ER. Until next time, stay curious, stay informed, and stay healthy.